Hello and welcome to another episode of Remarkable Rare, Living with SGS. I'm Kayla.
And I'm Zohan.
And we're two students from the University of Notre Dame interested in raising awareness for rare disease and Spritzen-Goldberg syndrome, also known as SGS, and we want to be better advocates. So in today's episode, episode 7, we're going to be talking about how to be a better advocate from a student perspective and just a culmination of all of our ideas, all of the interviews, the conversations we've engaged in, and we just want to go over a couple of the points that we thought stood out to us and how to be a better patient advocate.
So I think the first major point we want to cover is how difficult the entire journey is, right? Like, as we've heard from Melissa and all the other parents and caregivers, like, the journey is just extremely hard. You have like the uncertainty at the beginning of like the diagnosis, which is getting better over time, but it's still difficult. And even after the diagnosis, you still have all these surgeries, procedures, all this stuff like that. So, like, it's a really hard time for the patient and their families. And I think it's one of the key points where advocacy could really help them.
Agreed. I mean, one thing just from all the conversations that we've had so far is just realizing how incredibly different the journey is for the rare disease community compared to like any other road to diagnosis. We talked a little bit about the diagnostic odyssey in episode 2, and just from the perspective of how to be a better advocate, you want to be able to walk with patients throughout that journey and find ways to be patient and support them at times that they need, because it really is like, one day at a time and you don't know what's next.
Yeah, I think like going along with what you said, it's important to like walk with them, especially because like in this situation, a lot of doctors don't know or won't listen. So like if you're not there to help them like advocate, then there's nobody else but themselves, and the disease is already really isolating. So it's important to like be there with them.
Right, and I think advocacy like looks different in different stages. So coming from the diagnostic odyssey perspective, a lot of the families don't have a diagnosis yet. And so what would you say would be like good ways to just get involved as an advocate when, these families don't really have a foundation that they could potentially join yet? They don't have a community or a diagnosis that they can connect with yet.
Yeah, I think it's like your individual help is definitely important. Like just helping them maybe like take care of the patient a little bit, like give them a little help and like free time on there. But I think like most importantly is to like help begin establishing that community.
Mm-hmm.
So like of course with all rare disease it's like a relatively small community, and especially with SGS it's very small, but you can like begin to use whatever resources you have to like reach out and try to find other people and bring them together and connect them and start this like I guess very foundations of a community. And like I think through that you can like build up on that, and eventually you'll have like somewhat of a community, and that's probably the biggest help you can give them.
I completely agree with you on that, and especially with just hearing about Melissa's journey with connecting with the doctors, just being advocates to maybe help them reach out, help them be able to connect, do that research into like what kind of providers might be best, what experts might be best. So I'd say advocacy looks a lot different and a lot more flexible during those early stages for sure.
Mm. Yeah, so I think continuing on to I guess kind of a doctor's perspective, uh, like it goes along with this early diagnosis phase, but even after like the initial diagnosis, you have a lot of doctors that either don't understand or like don't want to learn from the patient because they think they know better,
Mm-hmm.
which I mean in general would be true, but in these cases it's not true.
Mm-hmm.
So I think yeah, it's like the second main point where our advocacy could come in and help them.
Right. I remember just our conversation with Dr. Fulkerson, a neurosurgeon, and he mentioned just the importance of collaboration And from his perspective, he definitely was talking about it for more like a professional setting, like being able to collaborate with other physicians who might have more experience in different surgeries, more novel treatments. But I see that extending into the, patient advocacy community as well. Being able to collaborate as a physician, as a health professional, connect and collaborate with patient families, patient advocates. I remember Melissa mentioning how important it was to have pictures of things. And it really is a collaborative process being able to like share those photos with each other, with those professionals, with the rest of the community, because with something so ultra rare, less than 60 in the world, according to the literature, and collaboration is just so important both professionally and in the advocacy world as well.
Yeah, for sure. I think especially for us, like we're able to bridge the gap between like
Mm-hmm.
the caregivers and the physicians since like we have background knowledge in like sciences and stuff
Right.
and we might have like better connections with the physicians.
Right.
And I think if we use that to like bring the knowledge that the caregivers have and present it in a way that the physicians will like understand and accept, that would like really help the issue like between the communication and just like the not listening.
Exactly, and I think that just in our stages, collaboration is so broad, like as a term, but just drawing out like specific examples, at this stage when you might recently have gotten a diagnosis, there's a lot of nonprofit organizations that do like music videos that connect with the patient. Um, they like sing me a story, for example. There's a lot of other ways to bring collaboration that supports different aspects of the patient lives. So it's important to like, okay, this might help with more resources, but this might help with more inclusivity side of things. So
Yeah, I guess just like a question for you, like what do you think is the best way to start that collaboration process? Is it with the physicians or with like other organizations?
yeah, I think that's a really important question. I think depending on the patient family, it might be different based on where you are and what sort of communities you have access to. I don't think, maybe there's not a best way to start off, but definitely being able to contact and be connected with as many people as you can. Maybe that starts with the patient who sees their provider and they get in contact with an advocate and they can work together as a team to create more research. Or maybe that starts out with the advocate at the foundation who's then able to be connected with the family. It definitely looks a lot different for everyone, but just being able to then, when you start with one person, be able to continue the connections across the board and see, because the rare disease community, it's very small for each disease, but big at large, big in the bigger picture, because there are a number of rare diseases. So there are a lot of people who sort of can relate, but you just have to be able to find,
Yeah,
the right resources.
yeah, I think that's a great way of looking at it,
Yeah,
especially like it's so much variance between like different rare diseases and even within a single rare disease that for sure there's going to be like different ways of doing it.
exactly. And yeah, I think that really does highlight the collaboration aspect a lot. And so another point that we wanted to hit during this conversation was just the importance of language. Um, we talked with different families, patient families with SGS, and learned with Tina and Katie in prior episodes. And Tina mentioned the importance of language and the importance of being able to ask questions, but in kinder ways, because it can be intimidating when you see someone with a rare disease to approach them and inquire more about the disease to learn better. But as we learned from that conversation, you know, from their perspective, they appreciate the curiosity, they appreciate the willingness to ask questions, but I think language definitely matters at that point. Um, and just that's just a very general way to get involved as an advocate, to ask questions, but ask it in a way that really shows that you're interested and coming from a good heart.
Yeah, I think it's like important to think of it from like both perspectives,
Hmm.
where like if you're the outsider, you're like in your anticipation of meeting someone that like you haven't met before, it's
Yeah.
like it can be pretty scary. Like you
Hmm.
don't know like what they're gonna say, like if you're afraid to offend them and stuff like that.
Hmm.
So you might be afraid to just interact with them at all. But I think on the other side too, like if you're the patient, you're like hoping to interact with people and share your story, but you're also afraid of them like judging you or
Right.
like just avoiding you because of what you have.
Right.
And so there's like this like stress and nervousness on both sides,
Hmm.
and it's important for like each side to see that in the other in order to like feel empathy and compassion and
Hmm.
like come together to like learn more about the disease, but in the like kind way that you mentioned.
Right. And like being part of the rare disease community is already isolating. Having an ultra rare disease is already isolating. So being able to, from a patient advocate perspective, you know, desiring to learn more and wanting to show inclusivity because, you know, from that conversation, she mentioned she just wanted to be included. They have different difficulties, but they still want to do the same things that everyone else is doing. So inclusivity was really important. And then just from Katie's conversation, she mentioned just a really important point about perception, how we perceive diseases, how we perceive rare diseases. And so, what are your thoughts on that?
Yeah, I definitely have thought about it a little bit before, where like, disease has this negative connotation, but I never thought of it like as clearly as Katie put it, where like, with disease like COVID, you just want to avoid people, right? It's
Right.
like more than just the connotation, it's actually like happening in action. So, yeah, I do think it's really important to try to change that at least for rare diseases because like they're not really like COVID or anything else. You don't have to avoid them. It's actually better if you interact with them.
Exactly. Exactly. Um, and you know, another point mentioned was just like they may be weaker in physical aspects or um, perceptual, what you can perceive, but they're strong in other ways. And so it's important to, as a patient advocate, be willing to learn more, and you can show that by getting involved with foundations, getting involved with patient organizations or nonprofits. There's a lot of ways to get involved with different diseases, and you can also start by meeting families. That's how I started. I met, Melissa, and I learned about the rare disease community, and that really shows the personal connection that you can have. And so, for anyone listening who really wants to get involved, there's so many different ways, but meeting different families and getting involved with that is just so important as well.
Yeah, I think that's also where the like advocacy part comes in
Mm-hmm.
because I think as a advocate, it's like your job to introduce other people to these patients and like spread that, rare disease is not just a normal disease and that
Right.
there's nothing to be afraid of and you should get to know them. And
And I think that really brings us to like one of our final points with what Melissa really highlighted in one of our prior episodes, and it was the importance of compassion. When she mentioned like how people can be better advocates, it's a really simple answer, and she mentioned kindness and compassion. And so, what do you have to, um, you know, say about that for other advocates?
yeah, I think it's like definitely the like centerpiece of like how to be an advocate and just I think honestly how to live life in general.
Mm-hmm.
Like I think without having that compassion, you can't really be an effective advocate because like you don't understand the other side, right? And
Exactly.
if you don't understand them, you can't help other people understand them. So
Right.
yeah,
Melissa mentioned just how you don't know what other people are going to. You can't assume what they may be having a horrible day. They may be having the best day, and the best thing is just to be kind and show that you're willing to help and meet people where they're at. And even with our conversation with Hannah, she mentioned how there's a lot that goes on the medical side of things that people aren't aware of with rare disease. And so from that standpoint, so important to have compassion as well, because there's a lot more work than it might appear sometimes, and it usually is a ton of more work, as we see, as we've learned from the families, 24/7 care, and you have great times, but it's so important as rare disease advocates to also know the reality of things, and to walk with them and be there and support them through the highs and lows.
Yeah, for sure. I think yeah, it like comes around, but without compassion, you can't really do any of those things effectively. So yeah, I really think Melissa just like hit the nail on the head. Well, I think just to like wrap it all up, like the most important phases I think for advocacy is definitely the like through the initial journey. It's important to like be there for them and like advocate for them either to doctors or just like other practitioners. I think the second part is after that diagnosis where you have like different doctors seeing them, it's important to like be a bridge and offer connection between the patient knowledge and like the doctors themselves. And yeah, the third one is, that uh, whole connotation and use of language. I think, like we said, it's important for advocacy to try to connect people and overcome these like connotative barriers. And yeah, last thing is just for everyone in general, just to have more compassion.
Exactly. Be willing to learn, spread awareness, and just come into the space with an open heart, really.
Mm.
Um, and so it's been a pleasure hosting this podcast with you guys. Again, I'm Kayla.
And I'm Zohan.
And thanks so much for tuning in to Remarkable Rare Living with SGS.